Welcome, Marnie, to the podcast. I am so grateful that you are here. And our connection has been so serendipitous because I just spent a lovely, lovely weekend with Aki, and I couldn't be more grateful, I guess is the best word, for how things panned out. And so thank you for being here.
Well, thanks for inviting me. And yeah, Aki is an amazing person. We love them so much.
Yes, yes. And I do too now. That was my first time meeting them, and they're so lovely. I felt so comfortable around them. And again, it's mind-blowing to me how these connections occur so organically and so serendipitously. And just, I think, more evidence of how connected we are to this this field is the only way that I can describe it. It's beautiful.
And how you have this baby, they seem like they're just going to be a baby forever, and then all of a sudden they're an adult out in the world having their own experiences. I remember the first time holding them and thinking, there's a whole brain in there with all of its thoughts, all of its feelings, all this stuff that I have no access to. It's both wonderful and sort of terrifying at the same time. But I guess really that's birth, and it's wonderful and terrifying.
Oh, perfect way to describe it. And I'm sort of at the other end of the spectrum. My little ones are only 3 and 6 years old. And so this whole like seeing that I don't have a lot of control over their experience and what's going on in there. It's beautiful and lovely and fascinating. And yes, terrifying in a lot of ways. So I'd love to get started with your background because it is so wide and varied, and I think very much contributes to your perspective on labor, birth, and parenthood in general. And if you could start with, I think, what guided you to the birth world and focusing on that in general, and also touching upon the all the amazing things that you do.
I got interested in birth. I had a friend who asked me to come to her birth, and I'd never been to a birth before. I had didn't know anybody else really who I'd been close to that had been pregnant. So, and what really blew me away about the whole experience was how different it was from books. You read about the process, you read about what's going to happen, all the different stages, and then it's just everything all at once. And you kind of think, oh, well, there's the first stage and the second, and then we have pushing, and it's not that. And that just fascinated me. And so then I just started going to whatever birth I could. I found places that were looking for volunteer doulas. And then I found out about a program. I don't think it's running anymore, but it was basically to train childbirth educators, and it was through Women's College Hospital and Humber College. And in that, there was you had to attend at least 3 hospital births. So they made all the arrangements. So you just went and hung out at the hospital all day, which was very eye-opening to be behind the nurse's desk, like to be involved in that way, where I wasn't doing anything. I was just there to observe. So, and it was just like complete strangers. I was just brought into the room. And so that was also a very fascinating look at it, because something that it really made me think about was this is just a work day for them. Like, this is a job. This is so you have these people coming in that are experiencing this life-changing thing, this family creating thing. And Lucy is just there doing her shift. And maybe she doesn't like the other people she's on shift with. Or sometimes it's just they're short-staffed. So they've just grabbed a nurse out of the pool who's like the nursing pool to come in and work. And some of them have never been to a birth before. Like they're just there to put in IVs, watch the tracings, do that sort of thing. So that was also very enlightening for me. And then I just started getting hired to go to births. And And yeah, it's always a fascinating experience. And every baby comes different. Every family is formed differently. And so it's just, I mean, you can't say there's never a dull moment because sometimes there are long, dull moments at a birth. I heard someone explain talking about war and that it's terrifying and boring. And I thought that's a very good description of this.
I've never heard it described like that, but yes, there are very intense moments and there are big lulls, right? Where a
Yeah.
whole lot is happening. A
And
whole lot is
sometimes
happening internally, but not visually.
exactly. And sometimes I'm at a birth and the couple are working so well together, or they've got it's the two of them and they've got a friend and they're all working so well together that I don't really do anything. I stare out
Mhm.
the window, I rifle through their fridge, I encourage, I make suggestions, and then there's other bursts where you're just like busy nonstop, constant hands on, like you're just exhausted and sore at the end of it.
Mm,
Not as exhausted and sore as she is, but yeah.
yeah, yeah. What have been some of the, I guess, incredibly eye-opening or kind of transformative experiences as a birth support worker that you've had, if you can remember some?
I think the biggest one for me was realizing, even though some people had worked in labor and delivery for decades, they were so afraid of birth. They were so afraid of the process. They hated the lack of control. They were much more comfortable if everyone on the floor had an epidural. Everybody was monitored. Like that made them feel confident and relaxed. But if you have a lot of women making noises and they're not monitored and they don't have epidurals, you can just see the anxiety and the fear rising in them, which then often comes out in like anger or snide comments. And so that was a big thing for me to realize that, because you kind of feel like, well, you've seen it all, you've experienced it all. The fear shouldn't be there anymore. You should be able to trust the process because you've seen it work. But so that was big for me. And then the effect, of course, that that has on laboring women. And no one is going to come in and say, yeah, this whole thing is very scary for me. No one's going to say that. They're just going to come in and say, well, you should be back in bed and you should have an epidural, and we'll mock the. And I've been in situations where we've had to ask for a different nurse because, she'll this one woman, she would come in and she would mock the noises the woman was making. And it's like, no, no, this is just not going to work. And then every time, like my back was turned, or if I went to use the washroom, she'd come in really close and say, like, you actually want an epidural, right? She's keeping you from having. I can get him in here, and we can have that epidural in right away.
Wow. Wow.
And so for some women, that's going to make them feel like, well, what I'm doing is wrong. And this is actually scary, and maybe I should be afraid. So
Mhm,
those
mhm.
kinds of
Yeah.
things. And but then also there's times where like you have babies are born and they don't make a lot of noise, but they're fine. They just don't make a lot of noise and they're wide-eyed and looking around, and I just love that feeling of just being with this little being, their first few moments on earth. It's such an incredible experience. It's just, and really, what there aren't many jobs where at the end of it there's a whole new human being.
Yes. Not a lot of jobs, true.
And so it's really just an incredible experience. And and so those are the things, of course, that keep you going. It's the other things that get you burned out and just feeling like I can never do this again.
Mm. Yeah, I want to just, I guess, double click on a few things that you said there, that sometimes this is just one day in someone's job that They've just been pulled from, the shift that they thought they were going into the hospital for onto a different floor of the hospital. And also that how they feel about the birth process itself is going to be projected onto the laboring person. And
Mm,
so if they don't trust the process, if they don't feel comfortable when all of the factors are controlled, if they don't feel comfortable with the noises and observing someone who is moving through so much intensity that they are acting and moving in very primal ways, if that makes them uncomfortable, they are going to unconsciously want to stop that. So it comes in
mhm,
the form of wanting to impose this treatment that will numb the pain. And that's okay if the person who is having that experience wants that, but it's not okay when the people surrounding that person want it for them more than that person wants it for themselves.
absolutely. And I mean, with a lot of the things that I say in the way that I talk, like I am not anti-epidural. I'm I'm against this idea that that's the first thing you offer. That's the only thing you can offer. As opposed to helping this woman see that they have the strength and resilience to do this. And often if I'm at a birth and she's like, I'm at my end, it's like, okay, could you do two more contractions? Could you do one more? And if they say yes, then you do that one. And then can you do one more? Because it's so easy to get lost in that. I think the hardest thing about birth is that you have the first bracket, you know when it started, but you don't know when the other one comes. You don't know when it's going to end. Is it 1,000 contractions? Is it 120 contractions? You have no idea. And that's where you could get lost. It's sort of like if you ran a marathon and they kept changing the end point. You don't know now, is your marathon like 40 kilometers? Is it 80? You just got to keep going. So, and I think people really need to be encouraged. And man, can women do the math fast? Like, okay, so I'm 2 centimeters and I've been in labor for 4 hours. So let's see, that's like a centimeter every 2 hours. So that means, oh my God, I can't go for it. It's like, okay, that might happen. That might happen. We might be here for 2 days, but this could pick up fast and we could be done in a few hours. So,
Yeah.
yeah, just trying to encourage people when they kind of lose that focus to just let's just slowly get back up on it again and see what we can do.
So it's about moving into the unknown and learning how to navigate this uncertainty that we're none of us are really fully comfortable with. And I guess leaning on the support that you have in those
Hmm.
moments when you really do feel like I can't do this. But I love that you said it can be really hard, but you are also resilient. You can do this hard thing. Your body
Hmm.
was built for it. Your body was made and designed for this specific thing, for this
Yeah,
specific experience.
absolutely. And something I talk about with my birth clients and in my prenatal classes is like pain is such a fascinating thing. And I know it sounds trite to say this, but in labor it is just pain. And the difference is pain is so often it's punitive and it tells you something is terribly wrong. But that's not the pain in labor. It's not punitive and it's not telling you something is wrong. In many ways it's telling you everything is okay. This is what to expect. This is what's going to happen. And I think, at one point, we were prehistoric humans. And so I think that one of the functions of pain and going through that was to let people know, do not let her out of your sight. Don't let her wander off. You have to stay with her. She needs help right now. And and also to tell you like things are getting closer because I've read in a few places that they don't really understand why labor hurts. They don't really, some people compare it to, well, when you have a heart attack and there isn't oxygen flowing to the heart, it hurts. But the uterus is made to not have oxygen, to contract like that and not have oxygen flowing to it. And the cervix doesn't have those kinds of pain receptors. So they're not really sure why it hurts. So that suggests to me there's a whole other reason for this. And also, the brain, when you have a painful experience, the brain logs what was happening at the time and all the emotions connected to it. So it can just do this shorthand thing. Oh, this pain, here's the emotions, this is what you should feel. And a lot of women have experienced a lot of trauma with that part of their body. So then you have pain there, and the brain's like, wait a minute, I have a file for this. Here we go. And brings up all those emotions and feeling and the fear and anxiety. But they're not a part of this right now. And so trying to release that and not really embrace the pain, but to just understand that nothing's wrong. It's not implying anything's wrong. You haven't done anything wrong. This is just the way this process works.
Yeah, I think that's where so much of the hypnobirthing and hypnosis training
Hmm.
can really support someone going into this experience, because there's a rewiring of those circuits that need to happen. And also very much honoring for so many women, like you mentioned, that we have experienced trauma in our pelvic area. And now we're
Hmm.
having this very intense experience that's eliciting so much sensation. And of course, our brain is going to be like, wait a second, I know exactly what's happening. Let me just pull up this file from 2017. And so a lot of some of the prep work that I support women through is, just going through that file system and being like,
Hmm.
what have I experienced? What do I what does come up for me when I just think about when I just say the word labor,
Yeah.
birth, pain, motherhood, postpartum, vagina, birth canal,
Hmm.
uterus, womb, like what emotions are elicited? And can we sit with that? Can we honor what's coming up? Can we face it? Can we do some of the healing in preparation for birth? Because if we don't, those things will come up, and we're going to go into that protection mode instead of opening and expanding.
And when you think about is it the fear, pain,
Fear, tension, pain.
tension,
Yeah.
and it makes total sense. You're afraid, you tense up, you get the pain, that makes you more tense. And muscles are pretty fascinating. So if you have a tense muscle, it sends a notice to the brain and says, hey, I'm tensing, what should I do? And the brain says, you know what, you should tense a little bit more. And so the muscle tenses a little bit more, sends a message up, and the brain's like, good job, tense a little bit more. So that's great if you're, carrying a heavy thing that you've got to get, or you're holding your baby. You don't want the muscle to just go, you know what, I'm done. So, but then that happens everywhere in the body until you step in. Sometimes you're working and your shoulders are up around your ears, and you just haven't really noticed that that's happening. And that's because it's doing all this stuff to keep you from, you could just keep working. We'll look after the tense shoulders by making them even more tense. So of course that happens with bodies, with the uterus, with the pelvic floor. So that, but the problem is then babes is trying to make their way down, and that's going to and then that just makes people more afraid. So fear and pain are they can be your friend, or they can, be an adversary in this situation.
Yeah, I'd love for you to bring some of your hypnosis training into the conversation here, because it is very much about like reframing the pain in this experience and giving ourselves the signal that, like, yes, I do feel these intense sensations, and that's okay, and that's good, and that's a part of the process, and it's bringing me closer to meeting my baby right now. And it's a practice, right? So it takes a while for us to rewire our brain and reframe
Hmm.
things so that it's almost like an automatic experience, because when we're in the labor and birth experience, that's not the time to do some of this work. It requires some prep beforehand, right? So that it becomes automatic.
Absolutely. And some people take to it very quickly, and and other people it takes a bit more time. And so that's why it's always good to practice beforehand. But absolutely, and I always teach self-hypnosis in the hypnosis so that and people can use it themselves. And it's great to get to someone sort of like mid-pregnancy
Mhm.
because almost everyone starts to have sleeping issues. And so it's great to teach them self hypnosis, and then, they start putting themselves back to sleep with it. And so then they realize, oh, this actually works. And and you're right when you mentioned reframing it. That's another really important thing. Because I think also one of the problems is like previously you would have seen birth. You would have heard it. You would know that your auntie or your sister or your neighbor was in labor and having that baby. You would have heard the sounds. But now it's our own birth is typically the birth of our first child is usually the first birth we're at. You're really learning on the job. It's a very intense job to try to learn and process all of it at the same time. So that's the other great thing about hypnosis is you can take people through the stages of labor and delivery. I always start by saying at a point in the future, at or about your due date, this is what's going to happen. And then, and so you can kind of take their body through the whole thing and then now see yourself holding your baby. And so it is almost like they've experienced it, they've seen the whole thing and now here I am with the baby. And often what I do with people is I tell them, okay, like let's just take a moment and imagine you're in early labor. Where are you? What's happening around you? And it's amazing the number of times that that is exactly where they were and what was happening. And so I find that so fascinating that we have that we're in touch with it is a little bit of time travel.
I like the description of it being like time travel because that's also how I describe it. So if you if there's infinite potentiality that exists in this field, you can sort of zero in and focus on and connect with the potential of you giving birth the way that you desire, whatever that is.
Hmm.
And so
Hmm.
you're kind of strengthening that connection and that intention with that potential. And I agree. It is so fascinating how often, like a snapshot picture that someone visualizes is exactly how things unfold. And that just for me shows that we have, not a lot of control over the minutia of this
Hmm.
experience, but we do have a lot of influence and impact. And that I think for people preparing for birth isn't really it's not emphasized, it's not spoken about, and it's forgotten in a lot of ways. And so we feel like we are just what's the word I want to use? We're so out of control. We're just like birth is happening to us instead of
Hmm.
something that is coming through us.
Absolutely. Yes, yes. And that movement of energy. And I mean, like, how is it not magic?
Right?
There's sperm and egg, and then this whole thing. How is that not magic?
I agree. Yeah.
And there's so much about it that we don't really understand. We kind of know how this happens, but we also don't know why it doesn't always happen.
Mm.
And and it's such a complex series of things that have to take place. I often am amazed that we have so many people on the planet. How does it happen all the time? It's a little mind-blowing.
Truly. I know the more I learn about it, I'm like, okay, I feel like the less I know in general about life. And it is really fascinating that it happens so often. We're so oblivious to just the magic that is present all around us. I think this is a good place to bring in some of your experience with shamanism. And I'd love to know how that's influenced your perspective on it.
I think it's really made me look at life as just part of this long journey that we do, and that we get so wound up in how do I look? How much money do I make? Where do I live? What do people think about me? What that are all completely meaningless. If you think of us as energetic spiritual beings that have solidified into human form, if you think about yourself that way, how can you be concerned as to whether your belly is a certain size, or whether your hair looks a certain way? Or, I mean, obviously we live within capitalism. We need a certain amount of money to survive, but that's not the only thing we need. But man, can that be the focus? And I think, and it's really made me think of tragedy in a different way. That, and for me, not always at the moment. I sob when someone leaves this planet, and I can get upset and angry with people. But I had a shaman say to me one time, don't get upset about if you get stuck in traffic, or don't get upset because of the where you've taken your life has taken you. You have no idea what spirit has saved you from. You have no idea what may have happened had life not taken you here and to this point. But also, we're all here to have certain experiences, to learn things. And so you obviously you're going to get upset if someone close to you passes, regardless of their age. But in some ways, we should be happy for them. They succeeded in meeting and doing what they were supposed to do in this lifetime. And now they get to go on to this other place. And as a shaman, having journeyed to these places, they're fabulous. They're amazing. There's sometimes with some shamanic things that people do, they make you sign a contract. You agree to come back because it's beautiful there. It's fabulous there. Sometimes for some shaman, they'll make their favorite dishes and then go and kind of put them under their nose. You have to come back to this life. You can't stay there.
That's amazing. Here's the bait. It's your favorite dinner. Come back. Oh, so amazing. Yeah, I think that was a stark reminder for whoever's listening, but also myself. I'm hanging out with your child this weekend. I was like, oh, everyone who I have felt incredibly betrayed by did a perfect job for me to become who I am becoming. I needed them to play that role exactly as they did. And it is all a part of this great, play, this unfolding. And
Yeah.
and it's only when you take that bird's eye view that you can really see that.
Oh, absolutely, absolutely. Because I mean, we are going through this as humans, and so we have all these emotions, all these complex emotions, and we aren't always encouraged to really feel and process those emotions. So then the more you push them down, the more you don't face them, then it's just going to come back.
Mhm.
And then you have to put more work into not seeing it, not facing it. And I think that's also where a lot of anger comes from, is that's because anger feels very powerful. Sadness feels awful. You feel small, you feel like you can't do it, but anger can make you feel big and like nothing can touch you. But in reality, all you're doing is keeping those things from helping you grow and maybe letting go of a bit of that anger.
It's interesting that things keep getting served to us, so to speak, until
Hmm.
we can relate to it in a bit of a different way, until we can really face it. For example, this woman that I was guiding, in her first birth experience, she had a water birth, and she was told to get out of the water before the placenta was born. And the process of doing that, because the midwife wanted to assess for hemorrhage, but in the process of doing that, the cord broke and there was a lot of
Mm.
bleeding, resulting in having to manually remove the placenta, which is excruciating. And
Yeah,
so there
yeah,
was this, beautiful birth experience of her baby, but a traumatic experience that happened right afterwards. And so for her second birth experience, which just happened a few weeks ago, we went through that experience and I was like, what exactly happened in that moment where you were told to get out of the birth pool? She's like, I felt like I just needed to stay, but everyone around me was telling me I need to get out, but I felt like I needed to stay. And so I'm like, okay, let's be grateful for that experience, because now you know that your internal authority is is priority. No matter what is happening in the room, no matter what people are telling you, that is the authority that you listen to.
absolutely.
And funny enough, in the second birth experience, the exact same thing happened. She was told to get out of the pool. But because we had sort of rewired and reframed things, it was her automatic response was to connect to her internal authority. And she said, even though you're concerned, I feel like I want to stay in the pool right now. And so she did. The placenta was born without any complications, and she was beaming, like, felt so empowered. Like, I did that, and it was by connecting to myself and something bigger, no matter what people in the room were telling me.
That's so beautiful. And because I think there's a lot about pregnancy and birth that uh, teach you about being a parent.
Yes.
And part of being a parent is being able to connect to that inner voice, that higher self, whatever it is that you think of it as, that tells you like those things that you need to do, or those people that you shouldn't trust, or you get that feeling. That's a legitimate feeling to have. Explore that, see where it takes you, see what's going on. And because I think that that's, so often I think that that's what people regret as a parent, is not paying attention to that voice, pushing that aside. And because again, we really are taught to disconnect from that. And I think that that can be the frustrating and soul crushing thing about some hospital births. She's so convinced to not listen to herself and her body, to just go along. And women are really still, in many ways, taught to be a good girl, do what you're told, everyone will love you then. And this is a situation where no, you need to listen to yourself and you need to stand up for yourself and you need to listen to that voice. It's an awful thing to see happen when they don't. And I think that really, like for me as a doula, I just got super burned out at one point. And it was after multiple hospital births where I just felt like I can't do this anymore. Like on the one hand, part of me felt like, but I can't let a woman experience go through this by herself. Like I just can't. But at the same time, it was like I I I don't think I can do this anymore. I just don't think I can. Not to say, and again, not to say that oh, every hospital birth is terrible or women should be afraid of birthing in hospitals. I'm not saying that at all. But I'm just saying that the things that you see, the things that happen, that you feel like this did not have to happen like this. And and again, I think something you were saying earlier about control. that becomes a big thing. And sometimes you see the power struggle, and it's like, just let her do it. Just relax, step back, go have some lunch, leave us alone.
Yeah, this reminds me of Barbara Harper. She's a big water birth proponent and travels the world teaching practitioners like gynecologists, obstetricians about water birth, nurses, midwives. And she says water birth is really just the gateway to teaching everyone about the power and the potential of the birth process itself. And she always talks about how the energy that a practitioner or a birth support worker brings to the birth room really, really does matter. So if everyone in the room wants to control the process, is scared that something is going to happen that is bad and detrimental and traumatic, and doesn't trust the process, then there is no way that the mother can feel relaxed and allow the process, allow what her body, allow that to unfold, because there's so much fear and projection that is coming into that space.
Oh, absolutely. And I think of it like I'm I'm sort of amazed that on the one hand, people will be, well, it's gotta, if a dog is having puppies, it's gotta be calm, it's gotta be quiet, you can't be going in and fussing with them and making a lot of noise. And then you're in the hospital, it's like, well, doesn't she deserve the same thing that you would give to a laboring dog? Doesn't
Exactly.
she deserve to experience that? And I've seen some things that, like, they were frustrating but funny. I was at a birth, and some of the forms, I guess, had been filled out incorrectly, and they sent this male clerk in to get the right information. And I'm sure that the nurses sent him in just to mess with him. But he comes in and she's like having a contraction, and he's like, I need your health card number. This number doesn't make any sense. And she's like, and and he's looking at us like, I need your health card number.
Oh man.
Like, yeah, you're gonna have to give her a minute, and I think that her partner can give you her health care number.
Yeah.
But he
Oh
was just like, so, like, why is it like she's gonna go, oh, my health card? Oh yeah, just one sec.
man. Yeah, these things that can just take you out of the experience, right? Anything like where the logical mind has to come in is going to
Hmm.
take you out of this very body focused, this creative, spiritual, very primal experience. But then you're just like, what's the number again? You can it's like a way to just take that away. And so it takes a
Yeah.
practice. Like someone who's preparing for birth should practice. I don't want to say should, but it is beneficial to practice coming back to your body. Like
Hmm.
having that circuit in place where I might get distracted, something unexpected might happen, but I know that I can come back to my center. And I've practiced doing that so much that by the time I'm actually in labor and birthing my baby, it is second nature. It is automatic.
Absolutely. And I do that. It's kind of a goofy little exercise that I do in my childbirth classes, and when I'm working with couples, is I have them hold an ice cube. And then they're holding the ice cube. And the first time, I just have them hold the ice cube. Don't do anything, don't talk, nothing. Then the next round, I do counting, inhaling 1, 2, 3, 4, pause, exhaling 4, 3, 2, 1. And then we'll try it with someone doing massage or hand massage, like, whatever it is that she would like to try. And then afterwards we talk about, like, so what was that experience like the first time when there was nothing to distract you? That's, most people are like, that seemed so long. And then some people, they liked the breathing, they didn't like the counting. Other people, they liked their partner being there, but don't move your hands. Don't do any of that. Like, just put your hands on me and stand there. And so that really helps them see, like, what is it that you like? What is it that helps you? And to see, oh yeah, I can see if you have to go through labor without any distractions at all. And then that also kind of opens up talking about the gate control theory of pain relief. If you bang your elbow and then you rub it, well, that makes it feel better because that signal goes faster and it overwhelms that part in your brain. So it shuts down the other feeling. So that helps them to see, right, that actually works. That's actually a thing. This isn't just some crap that this weird lady at the front of the room came up with. This actually works. So then that really helps people see, right, well, what else would I like to do? What else would I like to try? Do I want to try a tub? Do I want a ball? Do I want like a labor or like a labor stool? Do I want something like that? And oh, I just lost track of what I was going to say. I think that was probably just it. It just helps you see all of these different things that can come together to help you deal with this experience and how much of it is a mind game.
Yes.
That because once your brain gets in there and starts chattering away, and that's again where the hypnosis can come in, because a big part of hypnosis is just calming down that monkey brain that's always got something to say, always wants to get involved. And that's the thing with this is there's nothing for you to do here, brain. You just release that oxytocin, you just release those endorphins and keep everything else to yourself.
Yeah, so there's a few analogies I love here is the thinking brain in the back seat and leave it there. It's not the one who's
Mhm,
driving. Your body and your baby are the ones in the front seat. I love that you brought this up because it speaks to different people's personalities and what makes you feel safe, what gives you that sense and signal of safety to your unique individual nervous system. And for everyone, that's going to be a little bit different. So for some people, they want a lot of people hands on. They want to feel very surrounded by their birth partner, their doula, the midwife, the practitioner, like whoever is around them. They want to feel that presence. And for other people, the more space you give them, the more privacy, the more seclusion, that makes them feel safe and uninhibited. And so I like this practice that you're doing. So it's the ice cube is just sort of a way to find out what gives you that sense of relief and safety.
mhm.
What would you like? What wouldn't you like? And it can come down to I don't want to hear anyone's voice, but I want to feel gentle touch.
Exactly. I've been to births where and I always tell people like, have your ideas, things that you'll want to do, but just be ready to find out in labor you don't want any of those things.
Yeah.
So
And that's okay.
so one woman, there was a massage therapist that was coming at some point in her labor, and she had all this music picked out and I was there and her partner was there and there were two other people that were coming. And once labor started, we called it the don't touch me labor because she just like as soon as it started, people are like going, don't touch me, don't touch me, don't touch me, don't. She would rock back and forth and say, don't touch me, nobody touch me. But she wanted everyone there. She really liked that, but it was like, don't touch me. I'm so overstimulated by everything that's happening. I can't take hands on me like nothing. And at one point just took all of her clothes off too. It's like I can't even stand this stuff touching me. If I have another elastic band touching me, I will freak out.
I love that. And I think this goes back to the good girl and
Hmm.
the people pleasing that needs to be like wiped out of our psyche before labor onset. Because let's say you haven't practiced that skill of telling people, I need what your needs are essentially, like, I need space, don't touch me. And you would feel so guilty that you hired this massage therapist to come
Hmm.
and oh they might feel like they're not doing a good job or something about them, but you're the one in labor and they're there to support you, and so whatever your needs are priority in that experience. But sometimes that people pleaser within us can come online and take over, and that's where I find so many women have those quote unquote traumatic birth experiences because they desired something that they weren't able to verbalize for
Mhm.
whatever reason, and then they regret it afterwards because they felt this sense of self-betrayal.
Absolutely, and I think for some women, that's gonna trigger some intense postpartum depression,
Mhm.
which is, and sometimes it's it can be really hard to know what to do for them, and especially if it's someone that I wasn't at their birth. So I don't really know a lot of what happened. They'll tell me their side of it, but I wasn't there to observe the other things. So then there's only so much I could do. But that's also the hypnosis helps, the shamanism helps. I can journey for them. I can talk to them about what happened, and sometimes it sounds silly, but sometimes it's like, let's pretend you had that birth you wanted. Let's talk about it. What happened during it? How would you have felt then? And how do you feel now? So is there a way that we can bring those closer together, those feelings? And sometimes it's just time. Time is the only thing that will help. For example, I was at a birth and just everything went the wrong way. And it was an obstetrician that I didn't like to work with, and I should not have worked with these people. I should have just like, sorry, no, like go ahead, you can work with him, but no way. And because anyway, I don't have to go on. You know where I'm going with this. And so, of course, she winds up with a cesarean, and everyone does a cesarean slightly differently. So some of them take the uterus out. Some of them take the uterus out, wrap it in gauze, and hold it. And this person took the uterus out, wrapped it in gauze, and I think the next thing they did was unconscious. But they're waiting for someone to come and bring the gauze and the stick. And they were stroking and petting the uterus that was in their hand. I don't even know if they were conscious they were doing it. So the next day I go to see her, and she's like, "What's wrong with me? Everybody else who's had a cesarean, like they're up and moving, they can hold their babies. I am in such pain." And the nursing staff was like, "Come on, you have to get up. Look, everybody else is up. You have to get up too." And then I said, "Oh, yeah, your uterus was taken right out of your body. It was wrapped in gauze. It was petted. Like these are things that aren't meant to be touched. So, of course, you're going to be so much more stiff than someone who just had a straight up cesarean, the incision, baby's out, the uterus stayed in the body, like all of that. You are going to be in such a different position. So, if I hadn't been there and witnessed all of that, I wouldn't be able to help her. Instead of feeling like there's something wrong with me, I'm not going to be a good mom. How come I can't do any of these things? It's obviously because I'm fat. That's just so often what it will come down to. Whatever their insecurities are about their body, that's what comes up. But if I'm there and I can say, no, these are the things that happened to you. It doesn't say that on the form. It doesn't say uterus was removed from the body, wrapped in gauze and petted gently. So how is she supposed to? She can't see. There's that screen there. She doesn't know that anything like that's going on. So even though it's it may be, oh well, it was just a standard cesarean. You're fine, baby's fine, not a lot of blood loss. That's not really what happened. And I think it's really important that women know that and know that what they're feeling is normal for what happened to you. I can't hear you.
Okay, we'll cut that part out. Thank you for
Sorry.
that. I think it's so interesting that that happens when a uterus can stay in the body, that it would be taken out. And I'm sure there are different reasons. I'm not a surgeon, I'm not an obstetrician. So I'm sure there are valid reasons for when that would happen. But when it's possible to preserve the integrity of the human anatomy, especially in such a transformative experience, we would expect that the integrity would be, the word that's coming to me is honored and revered and
Hmm.
disturbed to the least amount possible. And the screen that is there, I think for a lot of women might be helpful. They might not want to really see all of the things that are happening, but in what's considered a family-centered cesarean birth, the screen is clear or taken down
Hmm.
so that the birthing person, so that the mother feels very much a part of what's happening and not just this numbed, you know, bystander.
Exactly. And that, and a lot of, I think, so I asked an obstetrician one time, like, why are these things so different? And they just shrugged and they're like, everybody's taught differently. That's just, if you were taught to take the uterus out, then you take the uterus out. If you were taught not to take the uterus out, then you don't take it out. But yeah, that's not enough. Like,
Yeah. I know so many of my questions in the birth world in general come back to, like, is it just the training? Is it the paradigm? Is it the education system? Is it the type of person that's attracted to this field of
mhm,
work, this line of work? Is it the environment? There are so many different factors, and we can go and we can try and blame and point fingers. But the work that you do, the work that I'm doing, I think helps to put so much of the power back into the hands of the family. And then they can educate themselves in whatever way they feel best fits their family and their values. And that prep work results in so much less trauma and lower rates of unnecessary intervention.
absolutely. And I think what people also need to know that it's from people advocating for themselves that change comes about and that new procedures are brought in or old ones are got rid of. And for example, I think that the first partner, a father in this case, that was allowed to stay in the birthing room, handcuffed himself to her
Wow.
because they were always like, okay, you can stay, but now she's going to have the baby, you have to go. And it was like in the late 60s, early 70s. And so he pulled out handcuffs and handcuffed himself to her. And then they had no choice. He had to stay there. And then after that, some people at that hospital were like, yeah, why do we make them leave? Like
Good
what?
question.
And so it's really from that. It's from, women questioning episiotomies that they started to reduce episiotomies. And it's really interesting. As soon as they go into a hospital and say, we're going to study your episiotomy rate, episiotomies dropped because
Wow.
nobody wanted to have themselves looked at, their work scrutinized. So they just, and to no ill effects to women or babies. And so that's really what started some people not just doing a standard episiotomy. Every time baby gets to here, we're going to do this. And they discovered, yeah, really, it doesn't make a lot of sense.
Mhm.
Women tear for a lot of different reasons, but they don't tear because you didn't cut them. And it's really, I find like the whole way the body is designed and the way that the baby is designed is pretty fascinating. Like, when the uterus contracts, it gets a teeny bit smaller and stays a teeny bit smaller. And babies, when they're a few days old, they lose this reflex. But if you take an infant and put their feet on something, they'll make these stepping motions because they have this instinct to push against whatever touches their feet. So they're head down and the uterus gets a little smaller. and that pushes their feet. So they push against it, and that pushes them down a little lower. So the whole thing just works so beautifully together. They reach the pelvic floor. The pelvic floor causes their head to rotate, their chin to tuck, exposing the smallest part of their head. And they get into the pelvis. And of course, this is in a perfect, perfect baby positioning, and then they get into the pelvis in a certain way, and then they kind of corkscrew themselves out. The muscles help to move them and turn them and get them out. It's really a fascinating, beautiful process. And of course, you have babies that refuse to go head down, and you have babies that are posterior. But it was really interesting work done by a midwife, Jean Sutton, and a childbirth educator, Pauline Scott, who started to look at, why are we seeing so many posterior babies? Nothing's changed about babies, nothing's changed about women. What is happening? So then they really looked at, how do we sit now? How do we work now versus how we sat and worked before? And bucket seats are really not your friend. That back of the baby's head, that's the heaviest part. Your knees are up, your pelvis is it that makes the pelvis open a bit more, gets that big hard ball of the head to drop into the pelvis that way. And once I started reading about that and started looking at the way desk chairs are, the way our couches are, the way the seats in cars are, like it really does encourage that shifting of the pelvis and that shifting of the baby. And of course, not that you can't deliver a posterior baby. It can just be a bit more work.
Yeah, those are two really good points. First, that the babies haven't shifted, our anatomy hasn't shifted, but our lifestyle has shifted. And
Hmm.
so I think just getting pregnant for a lot of mothers is the first time that they begin to look at the ergonomics of their life. A lot of women bring in the medicine, the exercise ball that they begin to sit at while they're working.
Yeah.
And the second part that you brought up that I really like is that we can still birth babies that are posterior
Hmm.
or breech, but it just requires some confidence in the practitioner themselves and the birthing person to feel confidence in their practitioner in that circumstance as well.
Absolutely. And I've worked with a few women who've had breech babies and seen amazing vaginal deliveries with breech babies. But there was one, it seems like every woman in her family seems to have a breech baby. And like her grandmother did, her mom did, her great grandmother did. So obviously it worked because they're all here. And so then she was like, but they all delivered like in hospitals in rural Prince Edward Island, some of them 70, 80 years ago. Why is it that I can't do this now? But she just couldn't find anybody who would take her on. So it was unfortunate because she really wanted to try. And well, anyway, I don't know. I can't see the future. So I don't know what would have happened, but it would have been awesome to have allowed her to try. But everyone was so afraid, and shortly after that they did a trial study at a hospital in Toronto to see, like, could we do breech births, but the outcomes, they stopped the study because the outcomes were so bad for the moms. People were panicking and doing big appease, like, and it's like, well, that's not a proper study. That's You can't just decide, oh, we're just going to do this and not bring in people who have experience in this, midwives who have done this, like, and have them attend the births and show you what to do. But it was funny, one of the breech births I was at, it was a teaching hospital, but also so many people who worked there had never seen a breech baby delivered. So the room was so full of people, it got boiling hot in there. And it all went really well. And it was so funny because, the little feet came out, And then the doctor, for some reason, decided like to swab the feet with like a antiseptic, but it was cold, so they pulled one little foot back in, which was just so adorable. It's like, oh, you're already like a little person. Like, that's cold. I don't like that.
Oh, I love that. That's so cute. And you're right. Why not bring in the practitioners who have experience with this very specific circumstance to show the
Hmm.
other practitioners who have never been trained? I think a lot of women don't realize that their practitioners have often never seen a physiologic birth, an undisturbed
Yeah.
birth, and have never seen a breech birth and therefore don't have any experience, don't have any trust in those things. And it's important to bring in the practitioners who do have that experience. Someone, oh, I'm mad at myself for not remembering his last name, but Dr. Stu is actually going around right now. He's an obstetrician and he's now touring to train practitioners on how to deliver a breech baby because it is so few and far between that are
Yeah.
even trained and exposed to that. Because sure, sometimes there is very valid reason for a cesarean birth in those situations, but it is still possible to
Hmm.
to deliver a breech baby and to give birth to a
Ab-
breech baby.
Absolutely. And I think, and again, like it goes back to this being afraid and not being. I think that a lot of people in the medical field have been taught to never say you don't know how to do something, never admit that you might be wrong, never admit a mistake. And they have found that when they try to change that atmosphere and get people to admit that they don't know, admit that they made a mistake, that things are so much better in those wards for the patients and for the people that are working there. But as soon as you have this atmosphere of you can't admit any of those things, well, nothing ever changes then. Nobody ever learns. One thing that we do know is that even if you are going to have a cesarean, it can be so much better for mom and baby to go through labor. And so why don't we do more of that? And then I think that, like we get into the situation where it's so unfortunate, but women, they can be so used to being like put together and looking a certain way and always having this sort of demeanor that the idea of going into that primal place of labor is off the table. They would much rather have a cesarean. And it's like, it just, you're missing out on a huge thing. I know you're missing out on the pain, but and being sweaty and smelling bad but there is so much more that you and your baby are missing out on by not doing this. I
Yes.
mean, that feeling after your baby's born, I would have a baby every day to feel that. Like that is such an incredible high is the only way I can think of, like you've been in pain, you're worried, you're all this stuff, and your endorphins are banging. And then everything is stopped, and it's just you and your baby and all those endorphins, like, your pupils are huge. It is like you've just taken some great party drug and and you can see it in women like when they get that baby and I think, I mean, no one should be denied that. Everyone should have the opportunity to at least try that experience
Hmm.
and
I
see where it
agree.
goes.
I agree. Yeah. I do want to touch upon a few things that we're kind of taking away from women and mothers. So, and there's no judgment when I say any of this because there is a time and place for every single intervention. But when an epidural is given, there is something that happens to our nervous system. So, when we are numbing a part of our nervous system, we're also numbing some of that responsiveness. We're numbing some of that primal action. And so a lot of women might feel like I wanted to say something, I wanted to do this thing, but for whatever reason, I just couldn't. It's like I was frozen. And it's because, yeah, like a part of you was frozen, a part of you was paralyzed. And so that part of you that wants to move and act and say certain things is taken offline. And so we're taking away some of that